survey from the National Association of Insurance Commissioners reports that 22% of U.S. consumers have cut back the number of times they see the doctor as a result of the economy and health care costs. Now, this data is putting health care costs back under the presidential campaign spotlight. Joining us this morning are policy advisors for both candidates. On our last policy discussion on energy, Senator McCain's camp was first to go. So this morning, we're going to flip it. We'll start with Obama's camp. Dr. David Blumenthal is an advisor to Democratic presidential candidate Barack Obama and joins us now. Good morning, doctor. Thanks for joining me.
Good morning. Thank you for having me.
So you just heard what I said about that new survey, the National Association of Insurance Commissioners, basically saying that 22% of Americans are cutting back because they're feeling the pain, they're feeling the pinch because of where we are in the economy. What is your response to that survey?
Well, I think it points out the need for a comprehensive program to rescue Americans from increasing health care costs and lack of insurance. And that's precisely what the Obama plan would do if Senator Obama is elected president.
All right, let's talk about that plan, because in essence what it's trying to do is allow individuals and small companies the opportunity to buy insurance, in essence like large corporations or firms are able to do. How exactly will that work?
Well, Senator Obama realizes that one of the greatest threats to people getting insurance is the unaffordability of insurance. And one of the biggest causes of the high cost of insurance is the inefficiency of what's called the small group and individual market, which is the area where people who aren't employed in large groups or aren't covered by government programs get their care. And about 30 to 50% of the cost of a premium in that market goes to administrative overhead for insurance companies, and that's clearly an appalling waste. One way to get around that is to get individuals, give them the chance to get together and buy in large groups, just like employers provide. And the Obama plan would make that possible by creating, letting the federal government act as an umpire to bring together groups of people in states and localities to purchase collectively.
All right, so aside from the issues of the insurance costs, particularly for the doctors, the other thing that this survey said is that 11% of Americans are cutting back on their prescription drugs. I know Senator Obama has a plan to address the cost of prescription drugs. Talk to me about reimportation and generics.
Well, Senator Obama would promote and support reimportation. And he would also create efficiencies in the plan, incentives for people to buy generically. Most good insurance plans actually encourage generic purchasing, the kind of insurance plans that would be promoted under the group purchasing arrangements that Senator Obama would promote.
You know, we have heard a lot of talk on the campaign trail about as many as 47 million Americans who are uninsured. We've also heard a lot over the past decade about the rising cost of health care coverage. Obama's plan says that he can reduce health care coverage by 8% and save the taxpayer $2,500. How do you plan to fund that?
Well, it's really important that we take out the incredible waste in our current healthcare system. And I want to get back to those administrative costs because that's the most appalling waste. And by making the insurance system more efficient, we can do a great job of reducing the unnecessary waste. But there are other very important things. One of them is bringing the healthcare system into the 20th century by making information technology, the kind that people use to buy goods in their stores, the kind that they use for withdrawing money from their banks, to make that more available in the healthcare system. The other things are to promote preventive services, which are very cost effective, also to promote care coordination for people with chronic illness. And the other thing the Obama plan would do is help small businesses and large businesses with catastrophic illness by taking those off the table for privately insured individuals and centralizing those, which would dramatically reduce insurance premiums.
Okay, so Dr. Blumenthal, just to be clear about this, the way you're able to fund the decline that you're talking about in health care expenses by 8% is by either cutting back on other areas or making sure that the costs, whether it's for health care providers, doctors in the system, start to decline with greater efficiency?
Well, we're not talking about cutting back on health care. We're talking about promoting cost-effective health care and modernizing the health care system.
All right. Dr. Blumenthal, thank you so much for joining us this morning. I appreciate it.